Good morning. My name is Isabel Jack. Can you say your name for the record, please?
Good morning, Isabel. My name is Emma Reynolds.
And what is your candidate number, please?
My candidate number is 227143460.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure, here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What job duties and field work have you handled in the past in your nurse job?
I have handled all kinds of different job duties as an ICU nurse. From changing the patient's drip to changing casts, dressings, and monitoring the patient's vitals. I can pretty much handle all jobs and field work that any other senior nurse of an ICU can handle. I also have years of experience in using computers and medical software to upload and maintain patients' files, important medical information, and other related data. When I have completed attending to the patients in the ICU, I can take care of the technological aspects of the job on the computer as well. I can confidently say that I'm well trained in all the ICU nurse skills that one would require in order to be a successful nurse.
What would you say is your greatest strength as an ICU nurse?
As a nurse, I can confidently say that I have a great amount of patience to handle difficult and frustrating patients. In the medical field and as an ICU nurse, I have often come across patients who have been extremely difficult to deal with. While most of my colleagues would lose their minds when dealing with such patients, I handled these same patients with calmness. I didn't lose my cool, and calmly explained to the patients what needed to be done. In the same way that a mother would handle a stubborn child, I handled things smartly and coolly. There have been times in the past when family members of patients have raised their voices in frustration at me and my colleagues. I have very gently, yet firmly made such family members understand the circumstances at hand, and calmed them down in my own ways.
What about your job as an ICU nurse satisfies you the most?
As an ICU nurse, one thing that really satisfies me is when I see a patient's health improve over the critical care days. As such, I have a very extroverted nature, and I make it a point to make ICU patients who are suffering from pain and trauma smile or laugh. A lot of patients have thanked me for my warm and friendly demeanor, and have said that it helped them recover much quicker. When given a feedback form at the time of discharge, most of my patients give me a 5-star rating for my excellent nursing services. Receiving this excellent rating for my skills and services gives me the ultimate professional satisfaction.
What motivates you?
Making a difference in the lives of patients and their families motivates me to be the best tech I can be. Making patients comfortable and help them through a difficult visit is what I look forward to. I became a phlebotomist because most people have had blood tests, and a good tech makes the difference in patients coming back regularly.
How would you handle a crisis or emergency situation?
In my work as a nurse, I'm fortunate in that I haven't seen many patient emergencies. When I have dealt with these situations, I always take a few deep breaths, or count to 10, to calm myself down, then focus on the patient or person who needs my help. Because I am not the most experienced with emergency situations, I would also ask for help or support from another nurse, doctor, or staff member who has dealt with more patient emergencies.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over, now you can start your roleplay. Don't worry if I stop you when the time is up.
Hello, good morning. My name is Emma Reynolds, and I am one of the registered nurses in this facility. For my confirmation, shall I know your name, please?
My name is Isabel Jack.
Hi Isabel, how are you feeling today? How is your baby?
We are doing good, thank you for asking.
I can see that you are frustrated. Could you please tell me what is bothering you?
Yes. Of course. I need your help, nurse.
Sure, kindly let me know the reason, so that I can give you some suggestions.
I have a problem with my nipples, and it's hurting me a lot.
Oh. I'm sorry to hear that. Could you please explain to me what kind of problem it is?
It seems like cracks, I have severe pain, and even bleeding sometimes.
Alright, I can understand your situation, but for my better understanding, shall I assess your breast once please?
Yes, you may proceed.
Thank you. Cracked nipples is a condition that can occur in breastfeeding women, as a result of a number of possible causes. It is a trauma to the nipple and can be quite painful. Typically, it appears 3 to 7 days after the baby's birth.
Yes, I can understand what you are saying, but I would like to know what exactly the cause is.
Sure, being a preemie mother, your inexperience, and the poor positioning itself, might be the major reasons for your present condition. When the baby is latched on correctly, the nipple is located against the soft palate in the back of the baby's mouth. When the nipple is near the front of the mouth, and being pinched against the hard palate, this will cause pain and development of cracked nipples. To be more clear, cracked nipples are the incorrect positioning, and incorrect latching onto the breast by the infant. The baby can create cracked nipples due to the strong sucking pressure, stretching, and pulling the nipple, the friction and rubbing of skin to skin. Am I clear to you?
Yes, you are, and as you said, it is very much painful, and I can't even bear the pain.
I acknowledge your concerns, and they are really reasonable. So, don't worry, I can provide you a detailed explanation regarding correct latching, and a brochure which contains all the feeding techniques, as well as feeding positions. Is it okay for you?
Can you please explain in detail, nurse?
Sure. When your baby latches onto your breast, the baby should have your entire nipple, and about an inch of the surrounding areola, in the baby's mouth. Baby's tongue should be down, and his lips should be turned out against your breast. You should hear your baby swallowing, and there shouldn't be any clicking or smacking sounds as the baby is sucking. Is that clear for you?
Oh, yes.
Here is the brochure. You may ask me if you want any clarifications.
Okay.
If you are feeling any soreness, even after following a proper position and feeding techniques, the doctor will prescribe you some medicines for faster healing.
Thank you, nurse, but in this situation, with this pain, I don't want to feed my baby. So can you please give me suggestions regarding the top feeds available in the market?
I realize that it is aching you. But, the best possible solution is to feed your baby correctly every 2 hours. By 2 months, feeding every 3 to 4 hours is common, and by 6 months, most babies feed every 4 to 5 hours. Are you getting me?
Yes, but I don't want to feed, as I feel that breastfeeding may distort my body image.
Yes, I know what you are feeling right now, and I understand your perspective. But, it is important to feed the baby exclusively for the initial 6 months. No other supplementary food provides enough nutrition to your baby as breast milk does. Breast milk provides the ideal nutrition for infants. It is a nearly perfect mix of vitamins, protein, and fat, everything your baby needs to grow. And it's all provided in a form more easily digested than infant formula. Breast milk contains antibodies that help your baby fight off viruses and bacteria. Breastfeeding lowers your baby's risk of having asthma or allergies. Plus, babies who are breastfed exclusively for the first 6 months, without any formula, have fewer ear infections, respiratory illnesses, and bouts of diarrhea. They also have fewer hospitalizations and trips to the doctor. Are you understanding my point?
Yes, nurse.
In addition to all these benefits, the physical closeness, skin-to-skin touching, and eye contact all help your baby bond with you and feel secure. Moreover, breastfed infants are more likely to gain the right amount of weight as they grow rather than becoming overweight children.
Yes, I understood all the points you conveyed to me, but right now my concern is regarding my body. Because I found many women after breastfeeding with a distorted body structure, and I don't want that to me.
I can appreciate this is difficult for you. But don't worry, with proper physical exercises or yoga programs, you can achieve a desired figure. Is that okay for you?
That is a great news. Are you sure about it?
Yes, I am.
Thank you, nurse. I am really grateful for letting me know regarding all these things.
You are very welcome, and we are happy to help you.
Great, I really appreciate your kindness.
Thank you. If you have any further concerns, kindly press the bell on your right-hand side.
Sure.
Great, I wish you a happy motherhood.
Thank you. That is the end of your OIT speaking role play. Thank you and all the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.